Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ondo government vaccinates about 400,000 eligible population since flag off of its mass vaccination campaign. Ondo medical expert emphasizes need for increased compliance with non-pharmaceutical interventions to reduce spread of COVID-19. French teachers stage strike that could close half of schools in protest of the government's changing COVID-19 policy in schools. Thank you for joining us. The Africa Centers for Disease Control says it is seeking to work with Pfizer to bring its treatment pill for COVID-19 to the continent, where less than 15% of the population has received at least one dose of the vaccine. It comes as the African CDC Director, John Nkegason, says just over 10% of the African population are now fully vaccinated. Meanwhile, in Nigeria, the number of daily infections reported by the Nigeria Center for Disease Control, NCDC, since the week began stands below 600, compared to over 700 cases logged earlier. The agency also reported 432 new cases within the last 24 hours. Here's more on the pandemic update.
432 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, indicating a drop from figures reported earlier. Lagos accounted for the highest number of cases with 163 infections. Rivers had 109, Imo 27, Edo 16, Kaduna 15, while Kwara registered 14 cases. The FCT and Oyo registered 13 cases each, Kano had 12, Akwa Ibom and Delta had 10 cases each, while Bauchi, Jigawa, Ekiti, Borno logged a single-digit infection. The total confirmed cases in Nigeria now stands at 249,586. The report also includes a backlog of confirmed cases from Lagos and Akwa Ibom states, as well as 0 cases from Ogun, Osun, Ondo, Plateau and Sokoto states. 644 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 220,839. There were 6 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,092. Currently, there are over 25,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. With over 16,000 positive samples, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.4% of the population have been fully vaccinated. The total global confirmed cases have surpassed 315 million, while deaths are beyond 5.5 million.
And about 400,000 eligible residents of Ondo State have received the COVID-19 vaccine since inception of the continuous vaccination exercise in the state. The permanent secretary of the state's Primary Healthcare Development Board, Dr. Francis Akembiemu, stated this in an interview with Channels Television.
Mass vaccination, including the engagement of additional public health facilities, have been deployed by most states in Nigeria as one of the strategies to scale up the number of COVID-19 vaccinated individuals. In Ondo State, the inoculation exercise is still ongoing with sustained mobilization by the government to ensure that a large number of its eligible population get vaccinated. Residents are seen at government offices and other public places in Akure, the Ondo State capital, to ensure easy access to the COVID-19 vaccines.
Since we have vaccinator, we have validators, and we have recorders. So since we vaccinate them, we record, and the validator will validate. So the work is not loaded on someone like before.
Some residents who just got vaccinated share their experiences.
Initially, we were afraid. Everybody was afraid. You know, now Nigeria. But now, we have the belief to take it. or let me say this is the right time for me to do it.
Maybe the reaction, they could be from false rumor, as we know in Nigeria, because I've taken it and they came to my office, Federal College of Agric, and vaccinated most of the staffs, and there were no adverse reactions.
The state government says it is taking steps to expand vaccination sites across the state. It is also encouraging residents to present themselves for the booster doses for optimal protection.
Everybody, please take your vaccine. If you are taking first and second dose and not taking booster, even your protection will not be as high as somebody who are taking booster. But as today, we have vaccinated over 400,000 population of Ondo State.
With ongoing efforts to educate the public about the effectiveness and safety of the COVID-19 vaccines, the Ondo state government is advising residents not to let down their guards and ensure strict adherence to the NCDC safety guidelines.
We talk some more on curbing the fourth wave. Joining us is Dr. Otefe Edebi. He's a consultant psychiatrist and psychologist, also a medical director at Grace Hill Place Hospital. He joins us on the program in Lagos. Thank you for joining us.
Thank you so much for having me on the program.
All right. I mean, let's begin. Quite a lot has been happening since the pandemic, and we've entered yet another year and seemingly battling a new variant. Do you think that the constant changes in the narrative about efficacy of vaccines, from protection to reduction in fatality ratios, has perhaps in any way affected the psyche of Nigerians about the dangers that COVID-19 poses?
Oh, definitely it has. It definitely has, and it's not a new phenomenon. You know, the fact that the conversation, the narrative about the fatality keeps changing. So, interestingly, in history, there was a similar situation in World War II in the UK. They had imagined that the bombing of the Germans was going to cause so much panic in the land, so much hysteria in the land, and they had prepared more psychiatric facilities.
Dr. Debbie.
For the assumed scare that and the psychic was going to have. They assumed that it was going to have an impact on them, but you know what they saw was that even after the bombings and all of that, the people did not react. So what's happening here is it's a case of what we call there are three impacts in terms of the psychic. There's something called the people who are directly affected, those who COVID directly affected. Then you have the near misses, those who were close to the people who were affected. And then you have the remote miss. And in Nigeria, we have more remote misses. And when you have more remote misses, what that simply means is that we only hear, most Nigerians, because of the fatality rates, it's when you talk about 3,000 in a population of almost 200 million, it's quite, and then when you talk about we have more remote misses, people who only hear from afar that COVID is present. So, and when you have remote misses, you often have people often thinking, their psychic usually is that of, we are not vulnerable to this challenge. So that's what we are having in Nigeria, because we have more remote misses than near misses. And that's because our fatality rate is quite low compared to other nations, developed nations, and all of that. So that has affected our psyche.
Does that also apply on the issue of hesitancy or the outright, unwillingness to take the vaccines? Is there a sort of mental willingness to take risks given the situation of relatively low death?
Yeah, like I said, relatively low death leads to us having this psychic that we are not necessarily vulnerable to the condition. I mean, I've heard people say, oh, it can be likened to malaria and all of that. I mean, these are facts in terms of, so you hear people say that. So the fact that we don't feel we are that vulnerable, it kind of affects our receptiveness towards taking the vaccine.
What can authorities do to change the psyche of citizens to enable a wider embrace of some of the protocols, the vaccines? I mean, given, the human being and social interaction.
I think it's already what we are doing, and I think we just need to keep working on what we are doing, which is our good community system. So we don't have, I mean, we don't have compared to developed nations, we don't have as strong hospital systems or hospital facilities like they do have, but we have a good community health system. So when we go to the grassroots, that's where, like our polio eradication, the vaccines is quite effective. And I think that that's one of the ways we can use to improve the uptake of the vaccine. So let's address it from a community based method, which we've used in other vaccinations. I think that that would be an effective way of increasing the uptake, which is what a lot of states are doing. So that's quite effective.
Do you think there are other examples, what we can learn from parts of the world, you know, to sort of adopt, to impact the psyche of Nigerians towards embracing better appreciation of health risks generally?
Now, psychic really has to do with information. You know, the thinking of someone is based on, or yeah, the perception is based on how he thinks, and the thinking is based on the information that the person has available. In one of the videos we watched earlier, we saw someone say we were initially afraid. So that's because of the kind of information they have received. So all we really need to keep doing is put out more information out there in strategic places like we're doing, and that will keep changing the mindset. So it's really about changing the mindset, and by changing the mindset, there will be better uptake and better receptibility to the vaccine.
We'd like to thank you for joining us on the program. Dr. Otefe Debi is a consultant, psychiatrist, psychologist, and medical director, Grace Hill Place Hospital in Lagos. Thanks again for joining us.
Thank you for having me.
And about 1,000 members of the Cross River Women Emancipation Initiative have received a grant of 50,000 naira each to support their businesses. Speaking in Ikom local government area, the wife of the governor, Dr. Linda Ayade, stated that the training and support of women will increase their productivity. She's asking for more support for women across the state as the aftermath of the COVID-19 pandemic left a big blow on businesses.
It's a gathering of women in micro and small businesses across 196 wards in Ikom local government area of Cross River State, organized by the Cross River Women Emancipation Initiative. The aim is to provide support for small and medium-scale enterprises to grow their business impacted by the lockdown as a result of the COVID-19 pandemic. The wife of the state governor, Dr. Linda Ayade, is calling for more participation of women in business to drive growth of the local economy.
It has been my word right from the beginning and inception of this administration that we have to take the Cross River women seriously. That's why we came up with Croway, because I believe, and all my women on this side believe also with me, that if you empower the woman, you empower the nation.
The State Commissioner of Finance says the project is targeted at empowering women to make their businesses sustainable.
The Croway initiative, your initiative, by identifying women in micro and small businesses across the state, we have a list of beneficiaries of about 1,000 people. We decided to train them, teach them financial management, build their capacity to enable them to be able to grow their business.
The Cross River government says this move is expected to stimulate the welfare of the people and boost economic growth for the state in the long run.
Still to come on the program, we have more on the importance of the COVID-19 safety measures. Please stay with us. Welcome back. A medical expert in Edo State has advised the public to continue the use of the non-pharmaceutical interventions in the fight against the spread of COVID-19. Director Disease Control and Immunization under the Edo State's Primary Healthcare Development Agency noted that these measures have been largely abandoned, explaining that they are actually important in reducing the spread.
it's really hard to tell you for sure how the compliance level is for these non-pharmaceutical interventions. But I can tell you from experience that it has been abandoned majorly on the streets of Benin. Wherever we go now, most of them don't have their face mask on. They don't wash their hands when they go in or touch some unsanitary locations, and then they don't observe social distancing, and they still lock themselves in enclosed spaces without ventilation. They go to mass gatherings without protection, without minding whether they should social distance or to wear face masks. So a lot of the non-pharmaceutical interventions are not being adopted by the people that I have met around.
And according to reports, U.S. President Joe Biden has criticized China's decision to cancel a growing number of flights departing from the United States for China because of passengers who later tested positive for the coronavirus, warning it could retaliate. In the meantime, the White House is revising its plan to battle the pandemic. Our Washington correspondent Maria Bird has more.
Those hospitalized in the U.S. are now not only unvaccinated Americans, but Americans that have received a COVID-19 vaccination.
About 10% of these COVID hospitalizations right now are in the ICU, and 5% are on ventilators. Now, as a point of comparison, this is a lower number than during the 2 prior surges.
The United States Senate conducted a COVID-19 hearing with top U.S. COVID experts discussing the use of at-home COVID testing.
Yes, there have been recent reports that, in fact, the sensitivity and the ability to detect in a swab of the throat versus the nasopharynx, at least with Omicron, that's a preliminary report. I think it needs to be validated and verified.
People should not use swabs that are designed as nasal swabs and try to swab their throat. They may stab themselves, okay? That would not be good, okay? What we need to do is have tests that, see whether the throat swab, as Dr. Fauci said, could provide more sensitivity. We do know the tests are picking up Omicron, but right now with less sensitivity than they did some of the other variants.
While COVID-19 at-home testing is becoming a part of the everyday life of many Americans, the White House is set to double COVID testing in schools.
So today we're taking additional actions, including sending 5 million free rapid tests to schools each month, and providing another 5 million lab-based tests each month.
There have been billions of dollars of investment in COVID-19 testing kits over the past few weeks in response to the major shortage of COVID testing in the past 30 days. From Washington, Maria Bird, Channel Television News.
And our correspondent Maria Bird joins us now virtually. Hi, Maria. The U.S. is seeing more children hospitalized for COVID, but are schools equipped, all schools, to stay open?
You ask a very key question. Are they equipped to stay open? And I think that's what many, whether it's politicians, whether it's parents, whether it's community organizations, they're asking that same question. And some areas are equipped to stay open. They've been able to put, whether it's testing measures in place, or they've been able to have high vaccine rates, or they've been able to do a mix of hybrid and virtual learning options. But for those areas that have not yet been able to look at various new innovative ways to address the educational system, are definitely struggling with keeping schools open. You have many districts that half the schools are closed in the district, and they are all virtual learning due to the high number of COVID cases, which obviously brings much stress to the communities. We also know that many of the school districts are with a shortage of school buses, which is the way in which students get to school each and every day because of the COVID virus, and knowing that many of the bus drivers are unable to come to work. So these are all measures that are creating major challenges for many school systems.
And some of those numbers are also leading to the U.S. that has registered over 1.3 million cases in 24 hours. Is there still hope that cases will peak soon? I know Dr. Fauci mentioned this at some point, and that is before they start to come down.
Yes, they are looking at this peak happening between now and the end of January. It's hopeful that by February we will begin to see the numbers going down. But I think that what we're seeing with testing, with a push for continued vaccinations, and obviously we all know the warmer months make it much better for many regions in the United States when it relates to the COVID virus. And so I think those are all things that will help to curb what we're seeing as a major spike at this time.
Also, an American researcher says more infections mean more variants. And then, there was also a report credited to the CDC suggesting the N95 mask can better prevent Omicron infection compared to the surgical mask that can protect against Delta and Alpha. What are you hearing about that?
At this time, the CDC has recommended, so you're beginning to see many school districts are requiring and they are having N95 masks available for students. Many jobs, many federal government offices are also making sure they're stockpiling those N95 masks as a way to potentially see if that does help to curb the spread of the virus. Now, we really won't be able to tell that until probably toward the end of the month when many of these entities have been able to really use these N95 masks, because we're beginning just to see it rolling out over this week and probably the beginning of next week.
Our Washington correspondent, Maria Bird, many thanks. And teachers in France have embarked on a nationwide strike against the government's handling of the coronavirus crisis. Ministers have made keeping schools open a priority despite a recent surge in cases. This is coming as France's presidential election campaign gets underway ahead of an April vote. The walkout is awkward for President Emmanuel Macron's government, which has prided itself on keeping schools open to ease pressure on parents through the pandemic. Here's more on the global COVID-19 update.
The teachers say government COVID rules in schools are confusing and constantly changing, and blame the government and Education Minister Jean-Michel Blanquer for what they call a chaotic situation in schools. The main trigger was France's health protocol, which has changed a number of times since December. Under rules announced on January the 2nd, a day before the start of the new school year, students exposed to a COVID case were required to take an antigen or PCR test and then self-test 2 and then 4 days later to continue classes in person. As coronavirus infections surge, the rule change caused massive pressure on testing capacity with long queues seen outside pharmacies. In the meantime, France has relaxed its restrictions for those traveling from the UK from Friday. Vaccinated travelers will no longer need a compelling reason to enter France or self-isolate when they arrive, but a negative COVID-19 test taken 24 hours before leaving the UK will be required, vaccinated or not. South Korea is preparing to begin treating coronavirus patients with Pfizer's antiviral pills on Friday, the first Asian country to do so, as concerns mount over the spread of the highly contagious Omicron variant. The pill, called Paxlovid, is numbering about 630,000 for 21,000 people arrived today to be distributed to 280 pharmacies and 90 residential treatment centers. The medication will be used to treat more than 1,000 people a day, with priority groups including patients at high risk of severe illnesses, those aged 65 or more, and those with reduced immunity. China's Tianjin city has reported an increase of COVID-19 infections as it steps up efforts to rein in an outbreak that has spread the highly transmissible Omicron variant to another Chinese city. Tianjin, located in northern China, reported 41 domestically transmitted infections with confirmed symptoms on Wednesday, up from 33 a day earlier, according to data from the National Health Commission.
For more updates and a better understanding of the pandemic, visit our website. It's channelstv.com. You have all your stories, including breaking news, at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.